The main concern is the lower front teeth and how crooked and crowded they were, and at different heights. This one is a lot lower than the other ones here. And from this angle, you can see just how crowded the bottom teeth are, and this one is pushed further in. The back teeth here on the side are leaning inward toward the tongue, and we were able to upright those back teeth and align these teeth here in the front so that they're all in the same line, and in this front view that they're all in the same height. These little bumps that you see here are the attachments that we used on the teeth. Those are essentially anchor points. They're temporary, and we removed them at the end of the treatment. For the upper teeth, you can see that this tooth here was too far tucked in, and we moved it out to be aligned with the other teeth there in the front, so it looks so much better. We did have an attachment on that tooth to help rotate it outward, and some attachments on the back teeth. But the biggest part of this case, if you look at her bite from this view, is that this tooth here was almost in front of the upper teeth and essentially in underbite or crossbite. And so we needed to align those bottom teeth, but find a way to keep them behind the upper teeth. You never want the lower teeth to be in front of the upper teeth and cause an underbite. And the tricky part is that when these front teeth align here, they tend to come forward. And if they come forward, then you can imagine that it would be much more difficult to keep those lower teeth behind the upper teeth. So we had to do a process and a procedure called IPR on this patient on the lower front teeth in order to keep them behind the upper front teeth as we straighten them out. We can see just how pretty it looks, and in just 8 months. So this patient is extremely happy, and we are so happy for her.